How do osteosarcoma types affect aggressiveness? Imagine a tumor that starts in your bones and can grow rapidly or slowly, depending on its type. That's what makes osteosarcoma so interesting and complex. Different types of osteosarcoma have unique features that influence how aggressive they are. Most of these tumors are considered high-grade, meaning they tend to grow quickly, invade nearby tissues, and spread to other parts of the body, especially the lungs. But some types are less aggressive and grow more slowly, which can impact treatment choices and prognosis. The most common type is called conventional osteosarcoma. It accounts for about 75 to 80% of cases and usually appears in the long bones of teenagers and young adults. This type is known for being high-grade and aggressive. It often invades local tissues and has a high chance of spreading to the lungs. Within conventional osteosarcoma, there are subtypes based on the type of extracellular matrix the tumor cells produce, like osteoblastic, chondroblastic, and fibroblastic. However, these subtypes don't significantly differ in how aggressive they are or how they respond to treatment. Another type is telangiectatic osteosarcoma, which makes up about 4% of cases. It has blood-filled cavities and high-grade sarcomatous cells. Because it looks similar to benign blood cysts on scans, diagnosis can be tricky. Historically, it was thought to be more aggressive than conventional osteosarcoma, but recent studies show that its behavior and outcomes are quite similar to the conventional type. So, it is still considered a high-grade tumor with a significant potential to invade and metastasize. There is also a rare form called low-grade central osteosarcoma, making up only 1 to 2% of cases. It tends to grow more slowly and has less aggressive behavior. It usually occurs in young adults and arises in the metaphysis of long bones. While it is less aggressive initially, there is a risk that it can turn into a high-grade osteosarcoma if it recurs locally. Molecular markers like MDM2 and CDK help doctors distinguish it from benign bone tumors. Other less common variants include surface osteosarcomas, such as peristeal and periosteal types. These generally have a better prognosis than the central conventional type, but their aggressiveness can vary depending on how high-grade they are and their specific histology. The behavior of osteosarcoma is also influenced by its molecular and genetic makeup. These tumors have a very complex genome with many structural changes and alterations in genes that control cell growth and death. This genetic chaos contributes to their aggressive nature and resistance to some treatments. Although the overall mutation rate is moderate compared to other cancers, the structural variations in the DNA make these tumors highly malignant. In summary, most osteosarcoma types, especially conventional and telangiectatic, are high-grade and aggressive, with similar outcomes. Low-grade central osteosarcoma is less aggressive but can become more dangerous if it recurs or progresses. The specific histological subtype within conventional osteosarcoma does not significantly change how aggressive the tumor is. The overall genomic instability of these tumors underpins their aggressive behavior. Because of this, all high-grade osteosarcomas requiring aggressive treatment, including surgery and chemotherapy, to improve outcomes. Accurate diagnosis and differentiation from benign bone lesions are crucial for planning effective treatment and managing the tumor's aggressiveness. Always consult healthcare professionals for personalized advice and care.